Right. Good evening, everyone. I guess we'll start. So today we're going to learn about how to stay protected during this respiratory season. Very fun or not so fun season. Okay. So we're going to start off with kind of a quick intro on what are colds, or what the common cold can look like, which is something that I'm sure all of us at some point would have experienced. So it is a viral infection that consists of the upper respiratory systems. So the respiratory system is kind of divided into two parts, upper and lower, and that kind of depends on what type of infection or what type of cold it could be. So in this case, for the upper respiratory system, it consists of the nose, the throat, your sinuses, your trachea, which is also known as your windpipe, your larynx, and the bronchial tubes. So these are just structures that are part of the upper respiratory system. And here we have a great image that kind of showcases where these structures are located. So we can kind of see we have the nasal cavity, we have the nostril along with our oral cavity, so the two openings, the pharynx and the trachea were over here. And then you can kind of see that it spreads into our lungs, separated by two parts right here, so right and left lung. And then the very bottom, you have the diaphragm. Okay, and now we're going to talk about what a viral infection is. So we know one thing, it is an infection that's caused by a virus. So usually the common cold is a viral infection, like we learned before, and it is commonly caused by viruses, specifically a group of viruses that are called rhinovirus. And there are over 200 different viruses that can cause a cold. So really, when you do get sick or when you are feeling ill, it sometimes can be hard to tell which one you have, but the most common one that we know of is rhinovirus, and about 30 to 50% are classified as a rhinovirus. So how is a cold spread? We're going to be talking about three different forms that they could be spread. So the first one being contact. So that's by touching someone or touching something. So for example, commonly used spaces like doors, handles, tables, anything that is touched by someone who is sick. If you touch that, you can get sick as well. And then we have airborne. So airborne, as the name states, are viruses that stay in the air and it's breathed in. And then droplet are exposures to infected bodily fluids. So with airborne and droplet, they can be breathed into the air. It just is a matter of the distance, which we'll talk about in the next slide. So in this image, you can kind of see the droplet-borne route, which is over here, and the airborne route. So with the droplet-borne route, it is still traveled or transmitted by droplets that you can breathe in, and they're usually medium or large droplets, but you can see the distance between the two individuals are shorter. And then with the airborne route, it's kind of transmitted, again, in the air, but the distance is larger. And the droplets are also a lot smaller. So how do I get a cold? So exposure to any kind of virus through droplets by an infected person can happen to a few methods. So coughing, breathing, which we all do, so it is something that can spread quite fast, talking, sneezing, any kind of direct hand contact. So for example, if you sneeze on your hand and then you use your hand to touch something or touch someone, that's a way that it can be contacted or spread. So contact with infected surfaces as well. Who can get a cold? So anyone can really catch a cold, but there are a few individuals who are more likely to get sick, are also known as high-risk populations. So for example, children, they do have a less developed immune system than many of us adults do, so they are at increased risk, as well as older adults who have a weaker immune system. The other part, or the other set of population that would also fall under here is those who are immunocompromised. So those who have a weaker immune system, they would also fall into this category as well. Who is likely to catch the flu? So when our body's immune system is weak, we are more likely to get ill. So that's why we say that immunocompromised populations are at higher risks. Some things or some factors that can cause the immune system to be weak are fatigue, physical and emotional stress, which is an interesting one because I remember anytime during school when I was stressed with exams, I would always fall sick. So any kind of emotional, physical stress you're experiencing, it kind of does indicate that you have the ability to have a weaker immune system. Malnutrition, so not eating right or not eating properly, compromised immune system, and repeated exposure to a virus. So when is it most common? So as we know, during the colder months, the frequency does increase. So this time is when people really stay indoors more often, and sometimes that can cause overcrowding, which means that the virus can spread more easily amongst individuals versus being outside where there is more open spaces and the ventilation is a lot better. Symptoms of the common cold. So they're divided into kind of two categories, early and late symptoms. So some of the early symptoms of a common cold could be like nasal irritation, a runny or stuffy nose, kind of the early stages, not so much heavily stuffy or heavily running, sneezing maybe a couple of times, a productive cough, mild chest discomfort, and a sore throat, or some people say they feel kind of like a tingling in the back of their throat. That's kind of an early symptom. And then more of the later symptoms are really increased versions of these. So thicker nasal secretions, whether you're blowing your nose or coughing, nasal obstruction. So the stuffy nose can make it harder to breathe, watery eyes, weakness, just generalized malaise and weakness. You may also have a possible headache or possible fever. Okay, so now that we've talked about the common cold, we're going to move on to the flu. So the flu is a short version for something called the influenza, which also is a viral infection, and this infection attacks the respiratory system as well. So we talked about some of those areas of the upper respiratory system, which include the nose, throat, and lungs. And this illness usually lasts for a few days, but in some cases, it can be very severe, and hospitalization and more medical care might be needed. So symptom management. So we talked a lot about what the symptoms are and how it can look like for a common cold and the flu, but how can it be managed? So if you remember anything from the last two slides that I've mentioned is that the common cold or the flu, they are viral infections. So usually for viral infections, you can't really take any kind of antibiotics. The most that you would be instructed to take from your care provider would be some like Tylenol to ease with the body pain or the fever. Lots of rest. So during this time, it's, you might feel a lot more tired or feel a lot more sleepy. Take it and make sure you do get that rest. Lots of fluids and making sure that you're hydrating yourself with water or warm tea and a proper diet. Even though sometimes it may be difficult to feel like you want to eat, it is important that you get those nutrients during this time. Okay, so now we're going to focus a little bit on the symptoms of the flu. So things like a sudden high fever. So usually the normal body temperature is between 35 to about 37.5 degrees Celsius. A sudden high fever would be something that's closer to 39 to 40 degrees Celsius. And this is a type of fever that lasts for a longer period of time, so 3 to 4 days. You might also have mild to severe headache, muscle ache and muscle pain, but very severe ones. You may also feel sudden tiredness or weakness that again will last for a while, so about 2 to 3 weeks. A runny and stuffy nose. You could experience a sore throat, severe chest discomfort, productive cough, and the main one here is shortness of breath. So some of these are very similar to the common cold, but you can see the severity of it would be a lot different. Okay, and now on to the topic, I guess, from the last 3 years, COVID-19. So coronavirus or COVID-19, it is an infectious disease which is caused by the SARS-CoV-2 virus. And both the flu and COVID-19 are both highly contagious and are caused by different types of viruses. So this virus is spread from an infected person's mouth or nose in small liquid particles when they cough, sneeze, speak, sing, or breathe. So symptom management of COVID-19. So again, most people who do develop or have COVID-19, they do have very mild illnesses and can recover at home and are required to isolate. Again, the recommendations have changed slightly a little bit different these days compared to how it was before. So right now it is actually to isolate when you are feeling symptoms. And you can end your isolation once you started feeling better or your symptoms have improved for 24 hours or for 48 hours if you have any gastrointestinal symptoms, so things like vomiting, nausea, or diarrhea, and have no fever present. Being vaccinated also makes you much less likely to get very sick or have the severe effects from it. So some of the symptoms of COVID-19, so you can have fever or chills, a cough, shortness of breath or difficulty breathing, fatigue, so feeling a lot tired, muscle and body aches, a headache. And this one was also very common in one of the first variants, so a new loss of taste or smell, a sore throat, congestion or runny nose, and then some of the gastrointestinal symptoms, so nausea or vomiting and diarrhea. So we have a little chart here that kind of talks about the similarities in some of the symptoms between COVID-19, the cold, and the flu. So you can kind of see with COVID-19 and the flu, fever is very common. With the common cold, it's very rare, so not so common. Fatigue, again, is a very general symptom, but can be experienced with COVID, sometimes with the cold, and it's very, very common with the flu. Coughing is very common with COVID-19 and the flu, but is rare with the cold. Sneezing, not so much with COVID-19. It is common with the common cold, and it does not occur with the flu. Aches and pains can sometimes happen with COVID-19. It is pretty common with the cold and common with the flu. Runny or stuffy nose, so pretty rare with COVID-19. Is common with the cold and can sometimes occur with the flu. Sore throat, again, sometimes can occur with COVID-19. Is very common with the cold and can sometimes occur with the flu. Diarrhea is rare for COVID-19, but it does happen. With the cold, not so much. And for the flu, diarrhea is a symptom that mostly focuses for children. Headaches, again, sometimes for COVID-19. Pretty rare for the cold and is very common with the flu. Shortness of breath, again, sometimes it happens with COVID-19, not so much with the cold and not so much with the flu. So here's a little image that says, do you have the flu? So it kind of shows symptoms between cold and influenza because we know sometimes the symptoms can be very similar, can overlap. So with the cold, we know that symptoms are very mild, can cause mild fatigue. The onset is more gradual, and it is felt mostly in kind of the head and nose region. And then with influenza, the symptoms are a lot more severe. You do feel more muscle or body aches throughout your body, which lasts for a longer period of time. The onset is very sudden and involves symptoms including fever, exhaustion, and loss of appetite. And then kind of in the middle are similar symptoms, so stuffy nose, coughing, sore throat. They are both a respiratory infection, which are caused by viruses. So I hope that makes sense. And a quick review of the two. So for COVID-19, It is possible for people to spread the virus for about 2 days before you experience signs or symptoms. And those who do have COVID-19 can be contagious for at least 10 days after signs or symptoms first appear. In the case that someone is asymptomatic, or if their symptoms resolve, it's still possible to remain contagious for at least 10 days after testing positive for COVID-19. And this is based on the current research and guidelines that we received. For the flu, so most people with flu are contagious for about 1 day prior to showing symptoms. Older children and adults with flu, they are most contagious during the initial 3 to 4 days of their illness, but again, they can remain contagious for about 7 days. And then infants and those who are immunocompromised can be contagious even longer than 7 days. So to review, for COVID-19, people can spread the virus 2 days before you start experiencing signs or symptoms. And then for the flu, people are contagious for about 1 day before showing symptoms. For COVID-19, you are contagious for at least 10 days after first showing signs or symptoms. And for the flu, older adults and children are contagious during the first 3 to 4 days, but they can remain contagious for about 7 days total. So you might ask, well, why should I be worried? There are a lot of effects and risks associated with having COVID-19. So it can lead to flu-related pneumonia, which is basically the inflammation of the lungs. It can lead to further complications and possibly deaths. So one of the complications being acute respiratory disorder. And that's something where basically the fluid in your lungs start to leak and it causes you to be in a situation where you require more oxygen support. And it can also worsen existing chronic conditions. So it is not something that we want to have, and we want to work to make sure that we can prevent some of those effects. So who is at risk? So like we mentioned, everyone is at risk, but there are certain groups that are more at risk than others. So we talked about children and the elderly. Also those with cardiac, so heart disease or pulmonary disease. Pregnant women where delivery dates are in the flu season. Residents of long-term care facilities, healthcare workers, and those with chronic conditions. So vaccination. So we know that vaccination can provide partial immunity. So vaccines do help us by preparing our body to fight the virus. What they do is help develop antibodies, which are ineffective for the first 4 to 6 months. Most effective prevention strategies help reduce the severity of illnesses and serious complications. So the flu vaccine. It is recommended that you receive the flu shot at the beginning of the fall, so kind of the beginning of the flu season. But if you have not been vaccinated, getting the flu shot can still protect you at kind of any point of the season. Every year it does vary, but usually peaks around January to February, and some years it can go as late as May. So the flu shots are available at our community health centers with SCHC. We do have the high-dose flu vaccines, which are not available in pharmacies for adults who are 65 years and older. And this one is a vaccine that provides better protection against influenza A than the standard vaccine, which is available for anyone over 6 months to 65 years of age. So here are some of the locations of the clinic. So we do have a location at 629 Markham Road. And here is the phone number. So it is 416-847-4101. Our clinic over at the Hub, so 2660 Eglinton Avenue East. And this clinic can be accessed during 9:30 and to 4:15 p.m. Wednesday through Friday. The phone number is 416-640-7391. And lastly, the clinic at 520 Ellesmere Road. Again, the phone number here is 416-297-7490. So you can take a picture. Maybe I'll hold for a second in case you want to take a picture of the locations and numbers. Okay. So staying up to date with the COVID-19 vaccines. So I know there must be questions regarding the new vaccine and the new boosters, and here is what we have so far. So these are the following vaccines that are approved by Health Canada to protect against serious illness from COVID-19. So we have the Pfizer BioNTech, Moderna, Novavax, and AstraZeneca. So starting in fall 2023, it is recommended that you get an updated COVID-19 vaccine dose or booster if it's been at least 6 months since your last COVID-19 vaccine dose or since you last had COVID-19, so whichever happened later. Also, children aged 6 months to 4 years do need multiple doses of the COVID-19 vaccines to be up to date, including at least 1 dose of the updated COVID-19 vaccine. People who are moderately or severely immunocompromised may get additional doses of the updated COVID-19 vaccine as well. If you do need more information, because I know that what I just showed was kind of a brief overview, if you need more information, here are some of the resources that are really helpful. So Toronto Public Health has a line, which is the Provincial Vaccine Contact Center. They are open Monday to Friday, excluding holidays, from 8:30 to 5 p.m. So they can assist with booking appointments or if you have any questions. And the phone number is 1-833-943-3900. Information is also available in multiple languages. You also can visit ontario.ca/COVID vaccines for more in-depth information about vaccines. And the last resource, which I want to share as well, is SHN, or Scarborough Health Network's VaxFax Plus Clinic. So this is something that SVHE is in partnership with. So VaxFax Plus can help you make an informed decision about the vaccines or help answer any questions that you have. So we do have a doctor there that is available to answer any of your questions or just provide you more information. The website is listed over here, and you are free to book an appointment if you need to. So prevention strategies. So we talked a lot about symptom management and vaccinations, but the number one, I guess the most important tip I would give for today is hand washing. So making sure that you are washing your hands frequently, when you return home from a long day, when you're before you're about to eat, anytime possible to wash your hands as much as possible to decrease the spread, and also sanitizing and cleaning those commonly used spaces. So we have a kind of like a guide. You might have seen these posters around bathrooms, and it kind of goes through a step-by-step of how you should be washing your hands. So just a reminder, so you want to wet your hands first. You apply the soap that's provided. You want to lather your hands for about 15 seconds, making sure that you're getting all areas, the back of the hands, the fingertips, and then rinsing well under the running water. Drying your hands well with a paper towel or a hot air blower. And then just important step over here is turning off the tap with the paper towel if available, and not your hands because you just cleaned it, so it'd make it contaminated. Also, in terms of stopping the spread of germs, you want to make sure that you're washing your hands at these instances. So anytime that you're sneezing, coughing, or blowing your nose, using the washroom or changing diapers, if you're handling garbage or playing outdoors, and also before and after use. So when you're preparing food or eating food, or if you're touching a cut or open sore. And the next image is about hand sanitizing. So sometimes you may not always have access to soap and water, so you can use hand sanitizers, which are also effective in cleaning your hands. So the note here is that people who are involved in food preparation should not use hand sanitizers, but should wash their hands with soap and water. But like I mentioned, if you do not have access to soap and water, you can use hand sanitizer. So you want to apply the sanitizer, and most of them should be a minimum of 70% alcohol base. You want to rub your hands together, lather and work the sanitizer between your fingers. Again, those key areas of the back of the hand, the fingertips, and under the nails. And you want to rub your hands until dry. So you want to make sure that you don't have any leftover sanitizer, because that if it is leftover, then it's not going to be effective. And same things as before, you want to sanitize your hands at the following situations. So after you sneeze, cough, or blow your nose, using the washroom, changing your diapers, handling garbage, playing outdoors, and before and after you prepare or eat food, or touching a cut or open sore. And also just a key note, if your hands are visibly dirty, if you have something on them, it is best to wash your hands with soap and water. If it's not visibly dirty, you can use a sanitizer. So some more prevention strategies. So disinfecting common surfaces. Again, as we know, many surfaces can harbor germs that can lead to illnesses. Because in the colder months, we do tend to stay indoors more often. We want to make sure that we are cleaning these commonly touched surfaces, either using soap or water. You can use an alcohol-based cleaner or disinfectant wipes like Lysol. And you can also wear a face mask or a face covering when in public spaces, especially when it's difficult to maintain that 2 meter or 6 feet distance from others. So for example, if you're on public transit, if you're in an elevator because it is a tight space, when you're out shopping because there's a possibility for overcrowding, entering and leaving a building, and you should also wear a mask when going to a medical appointment. And this does bring us to the end of the presentation, but I am open to questions if there's any.